Good afternoon and welcome to the Transforming Care Delivery in the Spirit of Value-Based Healthcare. We will investigate how a community of practice can give inspiration to stakeholders and especially to health managers. Value-based healthcare is a paradigm shift, shifting from a volume to a patient value-centered approach and improving teamwork within health organizations. It implies changing the way delivery processes are planned and designed. In the first half of the 75-minute webinar today, we'll have an introduction to basics of value-based healthcare, why bother, and what needs to be reconsidered. And then we will move on to a hands-on session receiving advice and hints on how to apply for the Univents of Healthcare Excellence Award, which recognizes healthcare organizations that transform their care delivery according to value-based healthcare principles. This webinar targeting health managers is organized by the European Health Management Association in partnership with Abbott and the Univents of Healthcare Excellence Award program. My name is Annette Rusanov, and I'm the Programs and Policy Director at EMA. The objective for today is to generate a rich discussion about value-based healthcare, motivate health managers, encourage them to join a community of practice around value-based healthcare. And this event also marks the launch of two papers with, that EMA and Univents produced together. One is Univents Making the Difference and Univents as a driving force for value-based healthcare. But we will hear more about these two papers from Professor Federico Lega, our first speaker. So without further ado, let me just introduce you our two speakers for today. Professor Federico Lega, whose name I mentioned. Now he's Professor of Health Management and Policy at the University of Milan, and he's also heading the Research Center in Health Administration. And Dr. Colleen Strain, who's a Scientific Manager at Abbott. Before starting, let me just remind you of housekeeping rules. Please keep your microphones muted during the whole webinar. If you have questions, please type them in the question and answer box, and we will read them out, or we will unmute you to ask your question after the presentations. Please note that this webinar is being recorded, and we will produce also a short report about the session, and we will make those available on the EMA website. We are live tweeting during the session, so please tag us EMA info and EMA webinars when you publish your tweet messages. So with this introduction, I will hand the floor to our first speaker, Federico, who will introduce us to the basics of value-based healthcare, and he will explain to us what value-based healthcare is and how it can be used and how it can be useful for organizations and especially for healthcare managers. And he will also launch the two papers. Federico, the floor is yours.
Thank you very much, Annette, and welcome to everyone. And it's a pleasure to be here with the possibility and the opportunity to have a conversation on value-based healthcare, and especially on how Univents contributed over the last years in promoting more attention and focus on this very important topics. So what I plan to do, as was already introduced by Annette, is first of all a discussion about what we mean by value-based healthcare, and try to frame the issue against the latest, rather say, research and debate that we had within health system, and then I will give you some further, say, in-depth understanding of how Univant's projects contributed to really advance the discussion and the focus on value-based healthcare. I'm gonna show you some slides. Started from this one. There it is. Now you should see, Annette, you can confirm you can see the slides too, right?
Yes, perfect.
Good. Very good. So the subtitle, why it is worth to play the game, is really the objective of this, my presentation. So why it is worth actually to try to use the framework of value-based care within health organization in order to really sustain the effort of transformation that professionals, clinicians, and managers are trying to do in order to really move to the next level when it comes to generating best experience for their patients, and obviously also generating more comfortable, or rather say more efficient setting where professional can really deliver the best care they can. And this is the agenda roadmap we're gonna have together this first part of the session. I will first of all discuss some basic principles about value-based care. Then I will try to enlarge the picture and show you how from the basic framework we have a larger view about when you try to answer the question, what makes a valuable health system? What makes valuable a health organization? Well, how can we answer that question? Obviously, there are very precise and already fine-tuned elements that were introduced by Michael Porter and his collaborator Theisberg when they developed the value-based care framework. But then there's something more that we will look at together. And so what is the agenda for a care manager? And finally, how value-based care can be successfully introduced within organization, and why Univant basically is a driving force in this path of change, of transformation. So let's start from the beginning, from the basic principles. When a few years ago, Porter and Theisberg introduced what is now well known worldwide as value-based care. They basically develop this model based on 6 components. So the basic theory about value-based care say you produce value-based care when you have in place those 6 elements. First one, you can see if we just look at, it's not actually one is more important than the other. No? Is always happening system is the combination between the different elements that really generate the best value. So there's no hierarchy. The numbers are just for a matter of classify the fact that we have 6 elements. But starting from number 1, the first element that really seems it could really make a difference is organization into what they call integrated practice units. I have to say this is not really new to some extent. We've been discussing multidisciplinary and multi-professional teams for many years. What I can say actually generate more attention and focus the fact that in the model of value-based care, it is clear that you have to create and build multidisciplinary, multi-professional team around specific medical conditions or segments of patients, which we often call them clinical service lines, or we often call them care lines. So the idea is that rather than have the organization organized as used to be only around the typical specialty silos, now what we want to have is much more an horizontal organization with professionals belonging to different specialty, the surgeons, the medical experts, the radiologists, the lab physicians, and so they group together and they generate a specific team to look after a medical conditions, a segment, a cohort of patients, and they have the task, obviously, of generating best guidelines, best clinical pathways, and update this over time. So this it is a revolution to some extent, because obviously healthcare organizations have developed according to the typical functional structure by specialty, because you have to have leader in charge of a specific knowledge area. But when you specialize, you often have a need for integration, and that's exactly what the integrated practice unit responds to, the need for integration generated by the specialization. So keeping that equilibrium within the organization, within the healthcare organization, can generate better value for patients, certainly because now you have a clear accountability in the integrated practice units in the team for treating the patients in the best possible way, is generating best possible outcomes, which leads us to the second point. Rather than measuring what we have measured so far, which usually are outputs, inputs and outputs, so resources on one side, what we use and what we produce with those resources in terms of volumes, of quantities. The value-based healthcare model stress a lot the fact that we need to move from quantity, from volumes for services to outcomes, measure around the single patients or the cohort of patients, the segment of patients, the segmentation that we've done before. So the idea is that really that there needs to be a new wave of key performance indicators that need to be introduced within health organization, because value is not generated by the number of discharge or the volumes of outpatient visits, but it's generated by obviously by the functionality that the patients recover after the treatment, is measured by obviously the zero level of complications or infections is generated by the time that it takes to recover to full health status. So to a different level of metrics that we need to really look after within the health organization. And once you have in place also this kind of dashboard, this kind of KPIs, then you can move also to a different funding system to align behavior to expectations and generating new incentives for the kind of behavior that you want within the system, which is first of all integration, cooperation, collaboration among specialists, among professionals, vertical and horizontal integration, GPs with the specialists and specialists with specialists and so on, or nurses with doctors and so on. So if we rather than pay as often still happen within health system on a fee-for-service basis, we start paying through bundled payments, which means we're going to give you a sort of a package to treat the patients, and all the specialists and all the GPs or all the clinicians and health professionals which have to collaborate for treating that conditions and that specific cohort of patients will receive a fixed amount of money. It could be also that there could be also some incentives on a sort of a variable part based on specific outcomes or specific performance, but they all share the same payments. And if they share the same payments, they need to cooperate, they need to collaborate, because they have a common goal, which is producing the best care with the most appropriate service in the right time, in the right place, with the right professional. There's no, as often happens, there's no competition among them to get the dollars or to get the euro or to get whatever is the money out of the patients, out of the treatment of the patient. For obviously, as we really know from a long time ago, from the I could say from what we introduced scientific management in the business environment, and then more recently in healthcare. The first ingredients, if you want to get integration and collaboration among people, is logistics. So you have obviously to generate specific integration among the different sites, which contribute and generate the integrated care for patients, which means that we need to move to specific networks. We need to structure those networks. That's why we talk in modern times of clinical networks or clinical managed networks. So we're starting to say that it is certainly necessary, obviously, to as much as possible generate through the logistics the opportunity for which specialists and other health professionals live the same spaces, living close to them. They have structure mechanisms for talk each other, to share information, and so on, and that's generate obviously more opportunity for integration, collaboration, and cooperation. One example of this is the recent theme of focus, so-called focus hospital. A focus hospital is like a multi-specialty clinic in which you have all the specialists belonging to different clinic working together. For example, in many hospitals now you have patients with cardiovascular, diabetes, and renal conditions, and you would expect that when those patients, especially the chronic one, very elderly, when they are admitted for a follow-up visit or for a control visit, they found all the specialists all together, the team, in the same place, rather than have to shop around and do different services or getting different exams in different places with a complication, obviously, with a very complicated agenda. And fifth is what is called expand geographic reach, which goes back to the notion of generating hub and spoke network. So identifying where are the specific expertise and technology where we should refer the most complicated or complex, I'd rather say, patients. So having sort of a within the network, a reference network, which means that there should be an agreement among professionals to refer patients to a certain colleague, which might have a better expertise on that specific conditions and have the technology necessary for what it takes to do the right diagnosis. Think about multiple sclerosis, think about some diabetes of a certain type, think about all chronic conditions. Actually, they could actually cardiovascular rather than neurological. No, they could actually very much benefit from the idea that, or oncology itself, obviously, they could benefit from a situation in which patients, rather than being kept in any place within the network, when he or she has a certain condition, will be referred to the specialist and to the place where they have the right technology to do the right examinations and produce the best diagnosis, and then define what is the best protocol or treatment for their patients. Then the patient could be referred back to the place where he is close to, when he lives close to, can be obviously managed by the specialist, which is more convenient from a logistic viewpoint for the patient itself. But the decision about what should actually be included in treatment should be done obviously in the reference center or where necessary within the network because of expertise and technology. And sixth and last, you can see at the bottom of the slide, build an integrated information technology platform. I mean, I don't think I need to explain this more than actually what is already written within the slide. If you don't have information, if there's not a good flow of information between specialists, between professionals, it's really difficult to generate the kind of integration and cooperation which generate value-based care. It is not a case that uni must start with uni, because you have to unify the system in different perspectives. You have to unify the professional in teams. You have to unify the sites or the hospital or the health organization in network, and you have to unify everything within the health system through the flow of information. If I go to any place and that place and that place, the professional there could not access my information, which had been actually saved in another place where I've been treated before. Actually, that's I mean, it's something that we can't afford anymore to have in 2022 as a way of functioning of our system. So we really need to build that as a next first, or rather say the first priority in health system transformation. So this is the basic model. It gives you a lot of food for thought, and I'd rather say a lot of inspiration about things that we can do. We can certainly improve within the health system. Then we can look at a little larger view of that, because when it comes to value-based health system, value-based health organization, we can think about that there are at least 4 different type of value that we generate. The value-based care model is very much focused on personal value. So making sure that the patient get the most appropriate and effective care, outcome-centered, cost-conscious. So the both. Sorry, I didn't underline enough the fact that value is generated when you maximize outcomes and minimize costs, obviously. So that's the basic ratio of what we mean by value-based care. But certainly that refers to the large notion of generating personal value for the patients. But there are other 3 kind of value which could be at the same time could be also nurtured by health system, health organization. The technical professionals, so through the identification of teams, best protocols or best guidelines, you also develop the professional side of the organization. So you also help specialists and GPs and the health professional to become better. And that's a value in itself, right? Because you want the organization to be really careful about nurturing and developing their own talents or their own professional. There might be an allocative value, which goes to equity and sustainability. Think about the network. Generating a network with reference, good access to the best place where they have the right technology, the right expertise. That's allocative value, because everyone should be allowed within a health system to get to the right place where they have the right expertise and right technology. And this often doesn't happen because of information asymmetry, because I don't really know how to get that kind of information. But what if the system actually provide you with immediately the referral to the right place? And then there's obviously a societal value, because if we really generate a more healthy population, paying more attention to outcomes and minimizing costs, so you also have obviously more resources to be invested in care, which goes back also to allocative value, but also we generate obviously better long life quality of, and well-being. So number of reasons for which we really need probably to introduce in the metrics the KPI that I mentioned before about outcomes, about cost, but also we shouldn't actually not consider or not enough consider well the fact that we can measure other type of value generated through the transformation that value-based care can inspire and generate within health system. And just to go from the system to the larger view, I can move the slide. Okay, that's it. To a sort of agenda, what we're saying is that starting from the model and looking at the big, let's say, picture of the 4 kind of value that could be generated through the transformation of health system and health organization towards the value-based care, we have now a clear agenda that is coming out for health managers and also for the clinical leaders engaged within the health organization in performing managerial task or having leading position within a hospital and health organization. And that's agenda. It's made of this 8 components. It's definitely a proposal, so I'm not saying that this is the agenda. Okay, it's just a way of drafting what could be something that I expect will be in the priority list of health managers, policymakers, obviously, but health managers and clinical leaders. Moving from top left to bottom right, we have pay for value. So one point in the agenda is developing mechanisms to fund and to compensate for health services, which, as I said before, should go in towards a pay for performance, pay for outcomes, pay for health. To the if you really look to the end point that we would like to see. So thinking about having a number of hospitals belonging to the same community area or territorial area, sharing the accountability for improving the well-being in that community, in that population. So contributing to the activity that they do for acute care, but also for prevention, for primary care, integrating vertically and horizontally. So at the end of the day, we could have a measure of 4, 5, 6 KPI of the populations, and we could say that that hospital will get from the health authority, whether it's the insurance or whether it's the national health system, whether it's another third-party payers, get an extra payment, a sort of a compensation for good performance if they improve the health of their population. So there's a lot of things that we could actually today concentrate on and generate more incentive to have organization and system really pay attention of value creation. Buy for value, we can obviously try to buy within system those devices, those products which show to have better impact on outcomes. Think about cardiovascular, think about, again, neuro, orthopedics, and so on. There's certainly the need to also rethink in many systems the way we assign tasks to the different professionals, doctors, specialists rather than general doctors, primary care physicians, nurses, other health professionals. That would be something that enhance or improve the chance that in that system you will get the most appropriate care by the most motivated professional to perform the job that he or she is expected to do, because you want to value professionality and you want to value roles and really engage them within the system. We could obviously have a part of the agenda focused on how can we pay innovation better than we do today. As any value-based innovation model we can introduce, which means basically how do we do HTA, health technology assessment, when it comes to innovations? How do we recognize transformational innovation from incremental innovation? How do we really compensate those organizations which are doing research and developing innovation which will change forever the way we deliver and generate good care within our systems? It's in this, right in this years, we will see, right in this last years and the next few years, we're going to see a major revolution with disruptive technology coming on the shop floor of health organization, in the shelf of our system, and that's going to be really challenging. And we obviously have to recognize the effort that research centers, teaching hospital, industry, and so on doing in that respect. How do we design a patient-centered and robust organization in looking at how do we manage a patient, the so-called patient flow logistics? The time of the patients is not for free, right? And when they enter the system, they must be treated as clients, not in the sense that actually they have the right to have whatever they want, but in the sense that they have expectations about being treated timely, in the most efficient manner, with the right attention to their conditions, and and improving the way things happen within hospitals and within health organization, having clear path care, clear pathways, clear agenda is necessary. Also, obviously, if you can look at the last 2 points, building the continuum of care and improving the patient experience are 2 points in the agenda which connect to the value-based healthcare, generating co-production, concordance rather than compliance in patients, which means rather than as used to be, have the patient, do what I tell you to do because I'm the doctor, and say, okay, we do expect now to have a bit of explanation. We do expect now to have a simplification or a discussion about alternatives. We do expect obviously to co-create, co-design, co-create, and co-produce services to some extent, especially when it comes to the big challenge of chronic care patients. We do expect to have a continuum of care. That's exactly the idea of referent networks and clinical networks and integrated practice unit within system, which generate a logistics also for integrated practice. And finally, doesn't really need much the explanation, the teamwork, multidisciplinary, multi-profession. We already discussed that before. So this is just a way of trying to say, put the bullet points of what could be an agenda for health managers in any health system or health organization. Say what I'm doing actually to improve on these areas, how much effort, how much attention I'm paying to this point. And there are two, rather say, transversal topics. One obviously is outcomes. So being sure that you spend a lot of time in measuring the right things rather than measuring what is easy to measure, which is the common answer that is done within a health system organization. And the second one is moving from curing to preventing, having what we call medicine of initiative. We want to have a system which, first of all, I could say focus on, or rather say, they pay attention to keep the people healthy, rather than curing the one that actually that gets sick, which is a different mentality or mindset within the system. So we should manage much better risk factors rather than diseases, and think about how much could be done in terms of value-based care when it comes to paying attention within the medical condition that you take within IPU, within integrated practice unit. If the team dedicated to that IPU, to that medical condition, start to work not only on clinical pathways to improve the treatment, but also on risk factors. How can we avoid that people get sick once they have certain risk factors, or whether they could develop the disease? How can we keep them to the lower level of severity in their disease? So that's the right question that we want actually clinicians and health professionals to ask themselves to do the best they can do. So hopefully let's clarify the big picture about value-based care and the many reasons for which this is certainly the key point that we want to see within the agenda of decision makers, policy makers, and health managers and clinical leaders. And there are obviously, as we already discussed briefly, but just to again leave with a clear, rather say, agenda for implementation. There are a number of actions that are required in order to do this. This is a list which is self-explaining, so I'm not going to spend much time. I just want to underline two things. Consider the patient perspective. That's more and more important, more than ever. Patients should be included in the co-design, co-creation, as I said before, and co-production of their own clinical treatment. And second is trained professional for both technical and soft skills. If we want people to work in team, if we want to have within the team a good leadership, if we want them to be effective as a team, this is not something that happens on a night basis. Okay, it does require that the clinicians which will be involved in teams and working in the IPU are trained to understand, especially those that will have accountability, responsibility for good, effective functioning of the team, to have a good training on their soft skills, on those skills that are required in order to manage other people. And this is not common, because you know better than me that often in the clinical environment that this is a very much understated topic. And quite often the majority, if not the all training that the clinicians and the health professionals receive is on technical aspect. Very, very low attention is paid to soft skills, which means helping them to really make the best out of their leadership capacity. I'm going to conclude just showing you what Annette introduced before. There are two papers that have been produced thanks to Abbott and Univance. Those two papers were the opportunity basically to frame value-based care against the projects that were presented at the Univance Awards and provide good exemplification of how value-based care can be developed within health organization. The first paper has the title "Making the Difference: Univance's Contribution to the Outcome Quest," and it's very much focused on how value-based care really provide the basis for turning the metrics and what we measure within health system towards the right things, which you look after, outcomes and patient experience. And you can see here some example of the projects that were presented for the Univance Awards and were also awarded as outstanding. You can see from the title, we'll be talking about reducing post-operative complications in cardiac surgery patients, intelligent liver function testing, a cost-effective way to increase early diagnosis of liver disease. I think how much can really make the difference, having a cost-effective way to increase early diagnosis of liver disease. That's really self-explaining. Improved diagnostic pathway and treatment for hospitalized patients with acute kidney injury. This is about patient experience. How can we actually help those patients to really have the type of experience that if we think about our relatives or friends of us, we would like to have when we have that situation, which we also often require integrated care by different specialists, by different levels of the system, and improving the safety of mothers and babies using androgenic biomarkers for preeclampsia. And that's again, very, very interesting case of generating value for a specific cohort of patients with a specific clinical conditions. And the second paper that was produced as a title, Univance as a driving force for value-based care. Here you have a clear discussion about how Univance can enhance PBM, but I leave to Colleen then the discussion more in depth about the awards itself. I just mentioned the fact that there are dimensions that they were considering for the projects that were submitted for the awards, which really help us to focus on the generation of value. And you can see from here some of the examples that were taken for this paper. I'm starting from top, reducing patient risk and enhancing care through the development of implementation of a new chest pain pathway expedited by and for the COVID-19 era. Again, self-explaining. I put here also on the slide, you can see the improved patient diagnosis, increased clinician confidence. So the numbers, the metrics that really help us to understand what value was generating. Kidney check, the next generation of surveillance for hypertension, diabetes, and chronic kidney disease. It is actually a huge amount of the population actually suffer from this three conditions. So again, you can understand how much it's important to have early detection of symptoms rather than degeneration of the disease. So these fantastic projects that really deserve to be awarded and recognized. Early diagnosis and improved management of patients with diabetes through strategic automated test algorithms by primary care. That's very interesting because we first time, not for the first time, but in this project itself, you can see how primary care can be involved in the big discourse of generating value-based care, because we often think about hospital specialists, clinical condition, but primary care is there, and there are fantastic projects that have been presented and discussed about generating value, study from prevention and follow-up and then surveillance and monitoring done at the primary care level. And then the last one is reducing catastrophic adverse events in patients with hemorrhagic shocks through early recognition of risk and system-wide automatic alerts. Again, medicine initiative looking to anticipate the issue and generated that kind of attention that we expect to improving outcomes because of that early detection. And so, and again, you can see all these 4 projects have specific metrics and specific KPI measure, and tells you what happened: cost savings, improve outcomes, improve quality, and so on. So, having said that, I finished basically my presentation. I hope this was interesting for all of you. I'm more than willing to provide further in-depth materials or whoever wants, actually through Emma. Annette actually can help us to coordinate this, and I'm more than open to Q&A, and the big arrow goes to Univans and Colleen for the next part of the seminar.
Thank you very much, Federico, for this very comprehensive overview, including theory, agenda for healthcare, health managers very clearly, and then some practical examples. We have questions directly to you, which I would already ask if you don't mind.
Yep.
And I would like to also just remind people to post in the Q&A box any questions to Federico directly. And I would like to also draw your attention to the chat box, which Marguerite Federica is managing. She put the links to the 2 reports, the 2 papers, which Emma produced with Univans and Abbott. The first question to you, Federico: how can healthcare professionals be encouraged to share capped bundled payments? And in the meantime, I would also like to ask Federica to unmute Doreen so that she can also ask the next question. So over to you, Federico. How can healthcare professionals be encouraged?
That's a very tough question, because I to be honest, I'd rather say it's difficult to encourage them to have capped bundled payments, because certainly they fear, and there's a risk in that. So I'd rather say it needs to be rather enforced within system rather than negotiated with a health professional. It's such a huge change that and it could be really difficult to think that you can do this kind of change through consensus or large consensus. But there's a strategy you can use, which is the following one. You could start soft adding money rather than so say you're going to have a bundled payments and an extra money if you achieve certain outcomes specific. So I have an incentive part of the or a variable compensation on top of the bundled payment, which actually could at the beginning easier than once you have experimented for a couple of years or 3 years, the time that you need in order to adjust to the new system, that you can decide whether you will include the variable part into the bundled payment inside the bundled payment, or keep it aside or lowering that. But certainly my final answer to the question is I do expect that the things that you have to put in place is enforce the system one side, a bundled payment, but on the other side, provide some incentives in terms of either variable compensation, extra variable compensation, or additional resources, which might actually come up because of the savings that you get from the bundle payments. So not necessarily pay them, but often them access to technology or other resources, logistics, and so on. What else, Annette?
Thank you. And then we have Doreen, who would like to ask her question, but I'm just conscious about time, that we would need to leave time for Colleen as well.
I can quickly answer.
Yes,
Doreen, because I can see the,
yes.
Not much. You're right, Doreen. There's not much actually that is offered to clinicians, and the value-based care debate has been very much limited to the scholar environment and to some of the political or institutional environment. I think it really needs to be pushed through the system, and especially to the level of professional and clinical leaders. There are some hospital, some organizations already done this. I know in the United States, in the northern country, not much in other Nordic country in Europe, but there's a lot of things that we could do better. And I think actually we need to certainly do two things: not teach, but share with professionals the reason for which value-based care could be actually being the way they frame their own work. So using them as a way actually to really represent the value that they generate in their clinical practice on one side, and a bit of soft skills to help them to work in a more integrated, coordinated way. Thanks, Annette.
Thank you very much. And I would encourage AEH, from AEH, the person to type the question in the box. Bigot. How do you see patient involvement in deciding what care is necessary, and how professionals should be facilitated?
Well, I certainly I can see what think about when you I mean, patients don't need to be really the one deciding, but they need to feel that they've been informed about the reason for which I'm making an example. I have kids which have a chronic disease, and when it was first diagnosed and it was the clinical pathway was developed by the clinicians, the specialists that is taking care of, I asked him, look, I love that. I mean, I love that actually you spend time introducing me to or explaining me the clinical pathways, but can you send me the reference, the articles, the scientific articles based on which actually, or the evidence based on which the clinical pathways have been developed? And look at me and tell me, they said, well, I never thought about that, but yes, I can give it to you, because because the clinical pathway that I propose it for your son is the most advanced. I can give you the evidence. Why not? Think about that. I mean, I'm not deciding. I just wanna be reassured that the person on the other side is giving me the best.
Okay, and what about shared decision making?
Well, there could be obviously some shared decision making in a certain situation when the quality of life is very much at stake. Think about oncology. Think about neurological disorders. So that's why I think we need to think about that. It's a co-decision. Yes, no doubt about that.
Okay, Annelies, if this is not a response to your question, then we can unmute you at the end. But now we should move on to the Univant's presentation and Colleen Strain from Abbott. Colleen, the floor is yours.
Thank you, everyone. I hope you can see my screen. I'm just
perfectly, Colleen.
Perfectly. Okay, wonderful. Thank you so much, everybody, for joining us. And thank you, Professor Lega, for the wonderful background on value-based healthcare. I think it really sets the stage for what we're going to discuss now, which is the Univants of Healthcare Excellence Award Program. And I think you said it best in your Q&A there, you know, the importance of how to frame your work and really show the value of everything that you've done and really show the value of your work. And so the Univants of Healthcare Excellence Award Program is actually a great opportunity to do that. So I'm here to give you a little bit more details about what the program is and provide some practical tips and tricks for the application process. And so for those of you who are not familiar with the program, the Univants of Healthcare Excellence Award Program is a global award that looks to recognize, inspire, and celebrate integrated clinical care teams who have really taken that opportunity to measure their value and showcase their outcomes. And so this is an application-based award program where applicants submit their best practices as well as their KPIs that really outline how they have unified across disciplines, a key component to value-based healthcare as well, to do something different to provide that measurable impact to key stakeholders such as the patient, payers, clinicians, and health systems. And so I'm sure you're wondering a little bit about the name of Univants, and Federico mentioned a key component many, many times, and that's unity. So the uni in Univance is all about unity, teams coming together, working across the care continuum to achieve something significant and of value for their health system and their patients. The next piece is the Vance. The Vance in Univance refers to being avant-garde. So not necessarily doing things the way they've always been done, but really thinking differently and using insights to drive better healthcare. And so we all can appreciate the vast amounts of data that is available within a healthcare system, including substantial data within the laboratory. Now, Abbott is a laboratory company. And so one of the key components of this award is the use of laboratory data and actually collaborating with your laboratory colleagues, including other colleagues as well from outside the laboratory. And so another key component to this award is, of course, the ability to measure and quantify success across key stakeholders, similar to value-based healthcare. Being able to quantify those changes and that success is key to really showing the value of the work that you're doing. And we're all aware that, you know, healthcare providers and those within the healthcare system do provide tremendous value, but it's that active activity of measuring that change that is so significant and so important to this award program. And so across those key stakeholders, you'll hear me mention them a number of times across this presentation. That's the patient, the payers, the clinician, and the health system. And so there are some, of course, criteria for eligibility for this clinical care or for this award. And the first of which is that the initiative must be implemented into clinical care. And so that means that within the healthcare system, this initiative or this process or this biomarker, what have you, is actually implemented into clinical care and used on a routine basis. Of course, you must have collaborated with colleagues outside of your department, whether it's you know, with your clinical colleagues, IT, other administrations. Of course, the laboratory does need to be included in this award application. And here we are again talking about our key stakeholders and measurements. There does need to be at least one measurable KPI across those key stakeholders. Now, measurements can look different depending on each of these stakeholders. So you can have quantitative or qualitative KPIs, but you must have at least 2 quantitative KPIs and no more than 4 qualitative KPIs or metrics. And so if you're thinking this is a great award and I'd like to apply, but I'm not exactly sure what success looks like, well, the best part of that is there's some great examples on the Univance of Healthcare Excellence Award website. We're now actually in our 5th year of the program. And so there are several years worth of wonderful best practices that really can give you an idea of what success looks like and how these programs actually achieve the success that they did. Now, I have included a slide here that can give you an overview of what some of those changes look like in the healthcare system. And so I will note that this slide is actually based on 36 best practices. So it doesn't actually include the most recent best practices recognized in 2021. However, this data is published, and for those of you who would like a little bit deeper of a dive into some of these programs, some of the trends within the Univance Healthcare Excellence Award program, I encourage you to have a look at this publication. It's from JLM in 2020, or sorry, EJIFCC in 2021, entitled Laboratory Medicine and Healthcare Excellence Till Death Do Us Part. Now, what the key takeaways of this slide really tell you is that change within a healthcare system can come in many forms. And it doesn't necessarily need to be expensive or fancy or anything like that. And so on the left of my slide, you can see that about 25% of the best practices implemented a new test method into clinical care to achieve the outcomes that they achieved. And so below that little graph, you can see a wonderful example of this, which was from Oxford University, where they aimed to improve the safety of both mothers and babies by implementing a new biomarker, new angiogenic biomarker for mothers with preeclampsia, you can appreciate the impact something like that can truly have on the decision-making associated with how to treat those mothers. And so if you want to learn more about their specific KPIs, I encourage you to visit the Univant's website, as it is laid out there, as it is for many of the other, or all of the other recognized best practices. In the middle there, you see this graph that shows that over 20% of recognized best practices actually focus on leveraging and utilizing informatics to inform decision-making, change processes, and really improve the way that patient care is delivered. And so the use of informatics, I suspect, is trending upwards as we power through our information stage. And you can start to see, again, if you want to visit the website for more details, that there are many best practices that leverage informatics. The one I've noted here is a brilliant case from Dundee in Scotland, where they leveraged an intelligent liver function testing algorithm to improve the way that they manage patients who have signs and symptoms of liver disease. And so this has been very useful in really streamlining care and making sure that resources aren't wasted, but also to ensure that patients get that care earlier on in their disease process. And last but not least, you can see that over half the best practices that have been recognized actually focus on implementing process changes. And from a health administration perspective, I'm sure you can appreciate the breadth of what that involves, but also the impact that you as health administrators can have on the delivery of care and the delivery of value-based healthcare, because you don't necessarily need to implement anything new from a technology perspective or a test perspective, but really just using the information from your institution to really enhance and change your process measures. And so, beautiful example of this, and I believe Professor Lega mentioned this, is the reducing patient risk and enhancing care through the development of a new chest pain pathway during COVID. And so this best practice comes from New Zealand, where they actually leveraged the data that they had in the emergency department and in the laboratory and cardiology to create an expedited pathway for patients coming in with chest pain, which you can all appreciate. I'm sure that chest pain is a very common presentation in the emergency department. So the ability to expedite the triage of these patients can actually have a profound impact on the way that you have flow in your department, not just for those patients, but for any patient seeking care. And so this gives you a broad overview of some of the leading change drivers that people may actually use to enact that change. Oftentimes, of course, there's a variety and a combination of things that really lead to that change, but this can give you a great idea and a sense of what that change can look like. So I encourage you to visit the Univant's website to learn a little bit more about these practices and to see some of those examples, especially when you're getting ready to apply. So on that note, I'm happy to share that the Univant's Healthcare Excellence Award Program is actually currently accepting applications for best practices now, and the application deadline is November 15th of 2022. So now is the perfect time for this webinar and the perfect time for you to start preparing your application to submit for recognition. And so I do want to discuss a few of the high-level steps that you'll have to go through so you can get an understanding of what the application process looks like, and also to give you a few tips and tricks to think about as you're working through your application so that you can maximize your opportunity for recognition. And so we're going to go through each of these steps. So the first one is to identify and define your integrated clinical care team. Now, if you're applying, you of course already know who is intimately involved in your initiative. And so this is your opportunity to identify those top 5 people who are involved. And those are the people who will be considered for the award. And so you provide your name, contact information, etc., so we can let you know the outcomes, as well as those other people who are involved. For a total of 5, you should of course include yourself. And I recognize that for most, if not all, integrated clinical care projects, more than 5 people are, of course, excuse me, involved in this success. So there's also an opportunity to identify all the disciplines involved. And given that this is a team award, and I've mentioned this in the criteria for the award, but you must list at least 3 disciplines really to show that integration, but you can list more, of course. And so when trying to pick those 5 people who have been involved, I encourage you to think about, and ask yourself if success would have been possible without this specific individual. And I think that will help you kind of narrow down who to include on your integrated clinical care team. Next, you'll be asked to describe your integrated clinical care initiative. And so this is really your chance to tell us what you've done. You have about 2,500 characters, including spaces. So it's meant to be a very concise, high-level overview of your clinical care initiative. And you have the opportunity, and I highly encourage you to, identify what it is done, what you've done, what clinical problem you're trying to solve and why it's important, as well as some of your kind of top KPIs, so that when the judges are reviewing your application, they really get a flavor for what you have achieved, and they'll be actually very excited to see some of the details of your KPIs. And so when I speak about the judges, of course, we have 7 partner organizations involved in the Unimonth Healthcare Excellence Award Program, and they are actually involved in assessing the applications. Abbott is not involved in that part. And so they're the ones who will be looking at this and be eager to understand what it is that you've done. Now, I say all that to say that these judging organizations come from all across the globe, and each partner organization has different specialties and focuses. So I encourage you to use plain language. Do not use unidentified acronyms, because everybody comes from different backgrounds. And so you want to make sure everybody can really understand what it is you have done. Do avoid the use of products and manufacturer names, and of course, proofread your work. Next, and arguably the most important part of your application, and of course, one of the most important pieces to value-based healthcare, is the ability to measure and quantify the change and the success that you've had. And so you'll be asked to outline your KPIs across each of those 4 stakeholders that I keep mentioning: the patient, the clinician, the health system, and the payer. And so, as I mentioned, you will have the opportunity to use quantitative or qualitative metrics in your application. Now, of course, I will say quantitative metrics tend to have a higher value than qualitative metrics because it's a quantitative measure of what you've achieved. However, there is an understanding that some measures are hard to really quantify. And so you can use qualitative quotes when you need an indirect measure of success. And so qualitative quotes should be attributed to somebody who can really speak to the credibility of that KPI. So for example, the head of cardiology can speak about the impact your initiative may have on their department and their clinicians. However, somebody in the lab probably couldn't. And so it's really important that you link those KPIs and that source to someone who can speak to it with credibility. And it's also really important when you're thinking about your KPIs that they are connected to the right stakeholder. And so I say that because, although I'm sure a clinician, for example, would be very happy to see a reduction in mortality for their patients, that benefit is actually more so to the patient. And so connecting the stakeholder to the right metric really can help you maximize your application. Within that same KPI section, you will actually be asked as well to describe the significance of your KPI and metric. And this is actually a great opportunity for you to really provide additional background and context to your KPIs. Like I mentioned, not everybody is an expert in the area that you are. And so providing that context can really help elevate the metrics that's seen. For example, a 1.2% change might not be significant in one area of expertise, but it may be so substantial in another. But without that context, the judges might not know. And so when discussing and defining kind of the significance, do make sure that you're being very specific and that it's not a generic statement about the impact of your whole program, but it should be very specific to that KPI. And the more specific that you can get, the better context it'll be for the judges, and the more able they will be to assess your KPI. Next, you'll be asked to just rate your clinical care initiative on some basic attributes. So uniqueness, ease of implementation, scalability, the level of governance, and its use of laboratory intelligence. And so it ranges from, for example, not unique, unique to highly unique. And it's just a simple select which one and provide an explanation. And oftentimes it doesn't need to be unique to be a great initiative. And sometimes the best initiatives are very easy to implement, right? And so really think about this and critically assess your application and your initiatives so that you can provide the best rating here for yourself and the most appropriate one. And last but not least is the opportunity to name your initiative. And so this is actually a very important section because this is the title that's going to be used for your potentially award-winning initiative. And so you really want to make sure that it's compelling and strong and inclusive of those KPIs that you've worked so hard to pull from your system. And so when thinking about what to name your clinical care initiative, I highly recommend that you avoid focus to being too generic and focusing on things like just a biomarker, but really hone in on some of those KPIs. Professor Lega mentioned a few great ones, but some other examples might be, improving emergency patient flow across the health system, or improved clinical pathway for recognizing undiagnosed diabetes in hospital patients, versus something a little more generic like procalcitonin in the emergency department. For those unfamiliar with that, it means nothing, and it might not really attract that attention. So really focus on what you've achieved. Now, given that we're in the middle of an award cycle, and I'm sure that there's, lots of questions and interests and what have you, I encourage you to visit the website. Of course, there's a lot of great resources, great examples of best practices. And there's also these resources that you can download and use. So there's actually a full application guide that walks you through the different sections in more detail. There's a great checklist that is just a quick one page, but it's just a sanity check for when you're about to submit to make sure that you've really maximized your application. And there's also an opportunity to use these offline worksheets, so you can collaborate with your team members in a meeting. You can send them out, you can share them with your team members, and really work together to create those KPIs and really work on your application. So I highly encourage you to use these resources. And if you still have questions, you need some help, the award administration team is always available through the Univance of Healthcare Excellence at abbott.com email address. So I encourage you to reach out to the administration team if you have any questions or need help, whether it's with the portal, with the application process, or you simply have a question. And so last but not least, I really want to highlight, this award is focused on celebrating and amplifying and sharing those best practices. And I mentioned that this is the 5th year of the award, and so far there has been so many wonderful best practices, almost 50, amplified across the globe. You can see here that initiatives span really the entire globe, and all across different disease states and approaches to their best practices. And so celebrating these best practices and amplifying them so others can replicate has been a wonderful success. And so those who are recognized with the Global Top honor receive a variety of prestigious benefits, including the prestigious title and award associated with the program. There's lots of local recognition by leadership, which can often actually be very, very special, as it gives people an opportunity to meet with that leadership within their own institution that you may not have visibility to prior to this. There's also, of course, a substantial amount of earned media, academic publications, formal recognition events, and leadership forums. So it's really about, you know, gaining momentum for your initiative, showcasing it and inspiring others, and showing people what happens when you collaborate. Professor Lega said it beautifully, you know, collaboration does not happen by accident. It's on purpose, and it requires focus, and it needs to be on purpose, right? And so being able to celebrate that and really show what happens is a wonderful opportunity. And I will share, last but not least, is that at the top right, you'll see quite a large trophy. This is called the Great Trophy, or Globally Renowned Alice Trophy. And this trophy actually travels the world and is showcased in the top performing sites in their lobbies. And at the bottom, the winning teams are actually listed on it. So it's a wonderful way to really celebrate what's been achieved and highlight some of those wonderful achievements that the care teams achieve. And so I'll share with you, as my last slide here, some key dates. I mentioned that the application cycle is now open and we're accepting applications until November 15th. So it's a great time to really start your application and get it moving. And then in mid next year, the winners will be announced, and that exciting process of celebrating and amplifying those best practices begins. And so I'll leave this here, and I will say thank you so much. And if you have any questions, I'd be happy to answer them.
Thank you, Colleen, for this very clear presentation about the eligibility criteria and also the benefits, the value of this value-based healthcare award. I would have a question, since this webinar is particularly for healthcare managers or health managers. What is the role of health managers? So how can health managers foster collaboration and motivate integrated care teams? As you said, you have to apply in teams so that they apply. So how do you see the role of health managers in the application?
That's a great question. And, you know, collaboration is, of course, a key part of this award, and probably the hardest part, you know, getting out of your own department. But I think that health managers are probably in a wonderfully unique position within their departments to really foster that collaboration, not just within their own departments, but reaching out as they can be the ones who help drive that education and really focus on that type of collaboration. I think Federico mentioned that there isn't necessarily training focused on collaboration, but there can be. And you can focus, you know, specific training. You can even encourage, you know, interdepartmental lunch and learns and things like that. In actual fact, even just sharing things, knowledge sharing like this award may in fact be a great catalyst for improving that collaboration. Share this with other departments. Are there opportunities for us to collaborate? Do you have even an application you want to apply for now? And so I think this ongoing discussion and continuing to reach out to your other departments and your peers within other departments is probably the best way to do it. Really be consistent with it. It doesn't happen on one meeting or a chance encounter. It needs to be very purposeful, and there needs to be a leadership role, which is why I think that health administrators really are in such a unique position to have such a great impact here.
Thank you, Corinne. Exactly, we should not underestimate the power of the preparation for this award as a kind of training course. So not an explicit training course, but an implicit one. A very quick question. Do applicants have to be Abbott customers to apply?
Oh, absolutely not. Absolutely not. So this is a product agnostic program, and so anybody who fits the minimum criteria can apply, Abbott customer or not. Even if you don't know who Abbott is, do apply, because Abbott's not a part of the judging process, and so it doesn't matter if you're an Abbott customer or not. We won't know either way because we're not involved in the judging or the scoring process, and it's completely product agnostic.
And perhaps for some organizations, it might be too tight deadline. So how do you see, if now raise awareness, they never heard about it before, we raise awareness now, do they have enough time till the 15th of November, you think, to put an application together? And if it's not possible, if they miss that, will it be repeated in 2023?
Yes. The award is an annual award, and so there will, of course, be other opportunities for teams to apply. The application process itself, have your clinical care initiative implemented into clinical care, you could certainly apply. It's just a matter of getting those metrics and really finding, the key components of the award. If you're not sure where to begin from that perspective, but you've already implemented into clinical care, definitely reach out to the award administration team, because they can help give you tips and highlight some opportunities, what have you, if that's your scenario. If you're not quite ready to apply, you've just started implementing things, or you're kind of inspired by what you've seen on the website, you can absolutely apply in 2023 and 2024, what have you. And if you're not even quite there and you're wondering, how do I start? How do I even begin here? Because I'm interested, but I don't know where to go. I have kind of 5 things that I would do. And I think first and foremost, you need a unified goal. You need to know exactly what you're trying to achieve. And then you need the right team. Collaboration is obviously a key theme that Federico and I have both touched on time and time again, and is obviously a key theme for the award program. And so building that committed and unified team who are really focused on that goal will help drive success. And I think planning in advance for measurement is a key component. We all know that greatness happens in healthcare, but the ability to measure that isn't necessarily people's focus when they implement new clinical care initiatives. But if you build that into your process in the beginning, it gives you an opportunity not just to quantify that, but also to monitor your progress, which is another thing that you want to be able to do, checks and balances, right? See how you're doing, see if there's any other opportunities. And then, of course, use a common language and leverage that so that everybody within your care team and beyond can really partake in this in a substantial and active manner. And so I think there's a lot you can do now if you want to apply, and there's a lot you can do now if you're thinking about applying in the future.
Thank you. And with that, we are coming to the end of our webinar. Thank you very much for our two speakers, Federico Lega and Colleen Strain. What we would like to display here is, Colleen already mentioned, and 36 best practices have been awarded, plus the 21 practices. So just a few examples from 2021. So one is HIV testing, another one is heart failure, and the third one is lab tests results in acute care setting. And we can just display also a slide about the winners a bit all over the world. So that's what happened in 2021. And then the application deadline is open till the 15th of November to submit your best practices. And I would like just to remind you of the eligibility criteria. It has to be a clinical practice. It has to include at least 3 disciplines. You should include at least 2 quantitative metrics and maximum of 4 qualitative metrics, so not more. And one of the KPIs should refer to patients, or clinicians, or health systems, administrations, and or payers. Colleen, would you like to add something to that, or did I summarize it correctly?
You summarized it well. And like I said, if there's any questions or comments that anybody has, please do reach out to the award program, and certainly look at the website, as all these details are available there as well.
And the website is available in the chat. Furthermore, in the chat, my colleague Federica posted a little survey to measure your satisfaction, how you liked this webinar, how useful it was. And I would like to also remind you of the 2 reports that Professor Federico Lega mentioned and that we launched with this event. You can see the 2 title slide, the two title pages of the reports. So don't hesitate to visit the EMA website and download them. We will make the recording of this event also available, and together with the presentations, we received that question as well. So of course we will make the presentations available, and also a short report. So thanks very much for attending this webinar, and watch out, we will follow up on this event. Thank you very much. Have a good afternoon.
Bye-bye to everyone.
Bye, bye-bye, bye.
Thank you.
Look at the papers.